So there's so on the positive side, uh, well, let me just first say this. This situation is awful, right? Everybody knows that. I mean, if we could not have this pandemic, that would be better. That being said, there are things that are happening right now because of COVID that are advancing the industry extremely rapidly, and it's causing healthcare companies to look at adopting technology in weeks and months that we've been talking to them about in years over the last few years, right? And it's also likewise really forced regulators to take a hard look at what are the regulations that are helpful and what are the regulations that are actually holding the industry back. And they've suspended some of those regulations. They've clarified some of the reimbursement models to allow for more rapid adoption of technology. So that's the very high level. Let me get a little bit tactical here. So some of the regulations that have been set up to really help in this situation that I hope will continue. One is that CMS on the remote monitoring side has allowed for remote monitoring to be billed for acute care, not just chronic. And that opens up a whole host of new opportunities to start to manage patients remotely, whereas you just simply couldn't do that before for any type of acute condition. So if it wasn't part of if an acute condition was not part of an already bundled payment where the health system or provider would realize some sort of value for adding remote monitoring, there's just simply no financial reason to do it. But now, because acute conditions are able to be billed under the RPM codes, that's a really big opportunity, in addition to obviously the chronic. The second thing is that health systems are now starting to recognize that, at least the health systems we're talking with are starting to recognize that the chronic care patients have to be monitored. I'm getting some background noise. I don't know if anyone else is, but yeah, chronic disease patients need to be. Can we make sure they're muted? Sorry. There we go. Okay. Sorry about that. It was just very distracting. So chronic disease patients need to be cared for through this COVID situation, and it's very likely that they should not be cared for inside of a healthcare system. And so we've had a lot of conversations with organizations, large health systems, as well as smaller regional, that are thinking through, we need this infrastructure in place today because, we had our quarterly checkups for these patients in January, February. They were scheduled to come back in April, May. It's now April, May, and we can't have them come on site. And when we just do a telephone call or a video visit, we're not actually able to get the data from those members that we really need to get. And so remote monitoring obviously will help fill the gaps there. So we're seeing a pretty big shift there. And actually, the FCC put out a $200 million grant program for health systems to apply for to implement remote monitoring and telehealth programs that each health system can apply for up to $1 million in funding through the FCC to help fund getting these programs up and running and in place. And we've been fortunate to work with a few of our clients on and prospects on getting some funding through that mechanism. But it's a great opportunity to really drive utilization for these new technologies in this environment. And I also just want to say, because you asked about ways to strengthen unique positioning, I just want to say, and I don't imagine anyone has necessarily made this mistake, but I've seen online companies do it. There are companies whose online presence and marketing messages are acting like either one, this didn't happen, or two, are like very blatantly trying to take advantage of COVID for their own purposes. And I just think that right now is a time when it's really smart as a company to realize that everybody, both us as individuals and our companies, as well as everyone we're trying to work with in healthcare, are human beings, and we're all going through this. And prospects are not prospects to buy something; they're people to work with. And I think that we need to really put the people first through all this, and make sure that we're being empathetic in our messaging and really trying to help other people.
Couldn't agree more. And again, nice segue. Switch up the order of my question 4 and 3, because sure. what you mentioned in terms of kind of propping up, some startups maybe propping up new channels or products lines to address the crisis. Important. Yeah. But what do you think, how important do you think it is for startups and founders to understand that what those decisions have both mid and long-term implications, right? So as much as it's important and our priority right now is dealing with the current crisis, whatever business decisions they're making need to have some applicability in a kind of post-COVID crisis, our market, so to speak. So how important is it to kind of weigh near-term priorities of today versus how those decisions are going to play out in the long term as well?
Yeah, totally. It's a really great question, and I mean, candidly, the way that we've been looking at it is the near-term strategy. We've been sort of executing on that for the last 45 or 60 days, and I think that was the time to do it. I think right now is the time to actually start looking toward the end of 20 into 21 and what 2021 is going to really look like from a market perspective, just because how long it takes to work with these companies and get product built into their hands. And the framework that we're using to think about this is, what is true today that was not true 45 days ago? And there are a lot of things, by the way, that are true today, right? 45 days ago, telemedicine was viewed as the future and something that clearly makes some sense, and we'd really like to get that out the door in a meaningful way. And today, everybody is using telemedicine, period. And there is no way.
The irony is too, I mean, telemedicine has been around for 20 years. And companies like yourself, totally. Remote patient monitoring, telehealth has been pushing, and now all of a sudden it's this epiphany that it's incredibly vital and important. But go ahead.
Yeah, no, it's so true. But the thing that is true today is that the horse is out of the barn, and it's not going to go back in, because you've now, like, CMS has seen that doctors can care for patients remotely via video, and we're seeking some clarification here. It looks like they might also allow reimbursement for telephonic services, which is fantastic. And so it's no longer going to be a niche commercial health plan arrangement. It's going to be just the way medicine is practiced. And I think that that's a very encouraging sign, and going to offer a lot of opportunities for technology to improve the quality of care, as well as further drive down the cost of care, as if you don't have to have these big expensive facilities needed for every single visit. So that's one thing that's true. But everybody is going to have something that is true for your specific niche of healthcare, and understanding what that is going to be kind of the key to really driving the value for your clients moving forward. That's how we're thinking about it.
Yeah, and I think as much as there are tailwinds, it's also assessing what dynamics are going to revert back, right, to what they were pre this crisis. It's that assessment is important as well. So there's tailwinds and headwinds, of course, as well.
Yeah.
And then the last question I have for you is, we talked a lot about the importance of accelerating kind of the strategies that are sustaining success and that seem to be working. But how important is it at the same time to identify and get comfortable with winding down or reassessing those where pivots are required? I think every startup right now, I mean, no matter what sector you're in within healthcare, there are opportunities to either pivot or restack priorities.
Yeah. And look, we are assessing this very directly. we have right now several strategy sessions planned to effectively ask ourselves the question you just asked me. So I think a couple of things. One is right now is the time to be swift to action. So if you do identify something and you can get very quick customer feedback to indicate that something is needed, now is the time to really deliver on a solution in weeks, not in months, because the planning cycle is just all screwed up for everybody, and buying decisions are happening in very different ways than they may have happened otherwise. So, for example, for us, we conceptualized a COVID home monitoring solution, and this was I don't remember the exact dates, but it was a Monday in May. I think it was Monday in March. I think it was like March 16th actually, and we conceptualized the COVID monitoring solution, and the next day swarmed the entire product team on speccing it out. Swarmed all the engineers on assigning story points to it and like figuring out what it would take, setting up a Kanban, started immediate development on it. The following Monday, we announced it with some, based on some early client conversations we were having who were very interested in it. And then a week and a half after that, we were onboarding our first health system client with that solution. And that's something that it was a mod of an existing solution that we had, but it was very custom tailored to meeting the needs of the market for this COVID solution. And by the way, we charged like basically nothing for it. It's like literally just covering our costs of AWS and Twilio is like what what we charged for the product, just so that we weren't losing everything on it. But the getting that out the door rapidly, it did a couple things for us. One is it really helped set us apart in the market in terms of us bringing a solution to market that was helping in a crisis. Two is that it really actually helped with a lot of conversations that we had already been having with health systems and payers around our remote monitoring solution, and it reinvigorated a lot of those conversations. So, if you have an idea and a concept that is that's time sensitive, make sure you really jump on that quickly. The other thing I would say during this, and I'm just going to hit this one more time because it's really, really important. Right now, as a startup, the absolute fundamental most important thing you can do, in addition to driving new interest and revenue in your business, is survive. And cash is the critical necessity to survival. And moving too slow on cash preservation is going to really hurt you. We've been fortunate that we've not had to reduce any team members. I know that a lot of companies are not in that situation, and I've been in that situation before, and it's really, really hard. But think about it this way: cutting, if you have to do a reduction in force, reducing one headcount today is like reducing 2 headcount in 6 months. So, moving early and fast is actually helping the greater good if you think that that's something that you're going to have to do, and making sure that you preserve the company for the good of the entire employee base as well as for your clients is really the number one job of running a business right now.
Great.
So I've got some questions for you.
Okay, great. And I will just say, Jessica, Drew and I could talk all day. So if we are running a little over, just please feel free to stop us for the Q&A, and maybe some of the last questions Drew has for me, we can answer through the Q&A.
Yeah, maybe Drew, if you can narrow it down to your top 2 quick questions.
Yeah, I'm so sorry. I didn't realize I was talking that much.
No.
Yeah, so I think that the most important thing that I want to know personally, just because I think it's really important for the industry to hear, is how are you as an investor assessing new investment opportunities right now? Because it's all over the map, it feels like, from what I hear. So how are you thinking about it?
Yeah, I think the general consensus, and one that I think is assumed, is that that the market for kind of deploying capital in new assets is more limited right now, or at least the priority is focused on how do we shore up assets in our portfolio, or doubling down on those, like Lytic, that are operating in certain sectors where the value proposition is not only incredibly important, but there are opportunities to accelerate that demand and meet those commercial demands. And so I think, overall the approach and the attitude towards new investments is still positive, and it's still a priority, but a lot more discipline will be required, right? And so it's just a matter of understanding what is the optionality. Is this an opportunity to kind of benefit from more reasonable pricing, right, and more reasonable valuation expectations? Yes, but it's a matter of just understanding, is the focus on securing the portfolio assets is a little bit higher priority than some of the newer opportunities. However, when looking at new opportunities too, I think it's a shift of mindset. It's what are some of what we talked about in this conversation, what are some of the longer term implications of what's going on in the market right now, right? And again, the dynamic is very different a couple months ago than it is now. I think, as a corporate investor, we're looking at how are the opportunities that are new, can they benefit our parents and help prioritize and accelerate our parent strategy during this time, and are the new opportunities those that can survive and thrive in a market post this crisis. So long story short, definitely focusing on new priorities, but I think the general consensus is right now making sure that you're doubling down on the value propositions that you've already invested in.
Yeah, that makes a lot of sense. And then, in terms of doubling down really on your own existing portfolio companies and making sure you have the cash reserves that they need, how are you, I just sort of talked you through how I'm thinking about this. How are you coaching and working with your portfolio companies around weathering this storm?
Yeah, no, that's a great question. I think, more than anything, it's helping them think through some of the internal exercises that you talked about. It's how, as investors, how can we help them think through the operational risks, the systemic risks, interpreting what their exposure is to commercial market impact. And I think it's also understanding, are there opportunities to deepen the engagements that our portfolio companies can have with our parents? Again, this is from the perspective of a strategic investor, but I think it gives us a unique position. Is there a way in accelerating those efforts to deepen what those efforts are with our parents? Are there new opportunities that we can open up for how they can work together? And are there ways that we can leverage the resources of our parents to help accelerate that?
Yeah, absolutely. Makes a lot of sense. All right.
Well, we do have a couple of questions from the audience. First is about reimbursement. There's rumors, I think, going a lot of ways about whether or not CMS will continue reimbursement after this is over, or if they're going to roll them back in certain areas. What have you heard? What are you speculating?
Drew, I'll let you go ahead first.
Yeah, sure. So, yes, CMS has a particular knack at not providing a ton of clarification around a lot of this. I do think that some of the reimbursements are likely to continue. So I mentioned, for example, adding the acute conditions onto the chronic for the RPM codes. I do believe that is probably something that's going to last beyond this. We haven't had any particular guidance on that, but I do think that's going to happen. There are other things that are not going to continue, right? So the suspension of HIPAA is not going to continue, I guess they didn't suspend HIPAA, but they stated that they would not prosecute for HIPAA violations during this time. So things like that are definitely not going to continue. What I do think is going to be really interesting to see how it continue, or if it continues or not, that I have no crystal ball on. So I'd prefer somebody who has a much more clear crystal ball on this to weigh in. But The fact that a lot of states have suspended the requirements for state licensure to practice medicine, and so it's allowed for telemedicine to be practiced across state lines. That is massive, and I think has the opportunity to really level the playing field and create new opportunities for virtualized care and lowering the cost of care across everybody, for everybody.
Yeah, good insights. And another one is here. Given all of the remote patient monitoring and telehealth, and the fact that a lot of clinics are closed right now because of the pandemic, do you see more like physical therapy, RPM technologies, and telehealth, and different types of therapies being used in a telehealth setting?
I don't have a particular specific purview into physical therapy, but I will say in general, we have seen an increase across the board for remote monitoring of any sort of disease state or condition. I mean, you name it, it's probably come up on a phone call that we've had. There's been just a massive increase across the board of people thinking through how to remotely manage conditions and work with patients remotely in this situation. I don't know if Anahita, if you have any specific views there.
I mean, how I'm hearing that question is, are there even, a wider breadth of applications for telehealth and remote patient monitoring, right? Than we've even seen, companies pursue now. I think it's important to think about in what capacity it's being delivered and where it's being delivered. And what I mean by that is there is a shift right now and a focus on how can care be delivered in the home, right? Especially for the aging population. And remote patient monitoring and telehealth has always been a proponent of how can you deliver virtual care, but I think the idea is how can you institutionalize that and create an infrastructure to make sure that those are delivered in the home and in areas kind of outside the four walls of the hospital, right? Or in instances where even independent practices, that visits and patients can't be seen face to face. How are you just facilitating that care so it can be delivered remotely? So I think the focus is really on, the type of population, newer applications for that infrastructure in the home is more of a focus maybe than thinking about of it across different specialties. But again, where is that being delivered and to whom that's being delivered? I don't know if you agree with that, Drew, but.
Yeah, I do. I think my camera's frozen, but I do hear you and I agree with you.
We see you just fine.
Oh, okay, good. Okay, it's just frozen on my side then.
And it's a little bit more of a longer term outlook. And that's, Drew, earlier you were talking about the telemedicine, telehealth, even telephone visits that are now occurring. Do you think that with all this practice, forced practice, it will lead to a faster adoption of value-based care, value-based payments? And is that something that startups should be thinking about now?
That is a really interesting question. I think that the technology capabilities and the payment models are not linked. What I do think is that there are ACOs and other value-based care organizations that are active today, managed care organizations, for example, that could probably benefit from this technology, and maybe this is highlighting even more how the technology can lower the cost of care for them. So I think that to the extent that you target those organizations very directly, I think that would be wise. That being said, I think that the true shift to value-based care is not going to be probably driven by this event in the way that we'd probably like to see, but I do think the adoption of technology will still increase.
Yeah, I mean, I couldn't agree more. I mean, I think that it's important to kind of unlink the two, right? I think that when business models that are based around value-based contracting and value-based arrangements, while important, just important to be conscious of the fact that they require kind of intensive resources for their customers to implement them, right? And so those that are selling in health systems right now, it'll be difficult to, I think, continue to kind of move those forward, at least in the near term, just given the distractions and the focus of health systems right now on COVID-19. And so it's not to say that they were stalled, but I think in this market, business models that are rooted in the value-based care arrangements may not be accelerated, just given the customers that need to have the resources to put them in place are a little bit distracted right now, right? Or are kind of reverting some of the resources that would be used on that towards the crisis. So it's just being conscious of that we're still in a world where value-based arrangements will be important, but just the resources to put them in place will be prioritized elsewhere.
Yeah. One more question from the audience, and we are at time. So just a quick response. Do you think that this situation is stalling investments in next-gen technologies like AR, VR, or do you think that those can be incorporated into telehealth solutions?
Like virtual reality was the question?
AI.
I have a thought, but Drew, go ahead. Want to give you
No, you're the investor. You're the
I think that, I mean, telehealth and remote patient monitoring are great examples. It has taken, almost 2 decades now for us to kind of reach this epiphany that telehealth is here to stay. And I give that example because certain AI applications, and especially virtual reality in healthcare, I mean, the jury is still out on defining what those applications are in healthcare and what the ROI is and what the use cases are. I mean, telehealth and RPM, the use cases are very clear. And so I think for those more to next gen type sectors, where we're still wrapping our head around what does actually mean in terms of day-to-day application, and what does it mean in terms of total cost of care and ROI, I don't think this environment is the time that those will accelerate. I think we're going to double down and buckle down on areas that are proven, again, like telehealth and remote patient monitoring. And so it's a little bit kind of ambiguous and nebulous around what will happen with those that are a little bit more futuristic. I think, of course, there are markets where those will accelerate, but not right now. I think we're going to double down on those areas that have the most impact on total cost of care and getting patients, staying in the home and monitoring them and avoiding this crisis.
Okay. Any thoughts, Drew?
Totally. No, I think Anahita nailed it. I mean, there's opportunities, but I don't think the market's figured out what they are yet.
Yeah.
Any final thoughts before we close it out?
No, I just want to thank you, Drew,
no,
so much.
Hey, yeah, absolutely. No, thank you for including me in this. And I just want to say, like, times are tough, and but there's big opportunities out there also. I mean, there's the one thing that is true that I can definitively say is that virtualized care and remote monitoring and other virtualized technologies for healthcare are much, much, much more needed now than they were 45 days ago. And it's a really exciting time to be a healthcare entrepreneur, even if it's under very difficult circumstances. So if anyone would like to talk to me directly, just hit me up on LinkedIn or Twitter, and I'm happy to have a conversation. So
yes, I just want to echo that. Happy to do that as well. Drew and I could have talked for a few hours, and so there were probably a lot of questions that the audience had. So please feel free to reach out to me as well via LinkedIn or Twitter.
Great. Well, yeah, I really appreciate the thoughts of the taking advantage of some opportunities and looking at the bright side and the optimism there, but also recognizing the really challenging decisions that people are having to face right now, and also really fast decisions to pivot or double down on certain capabilities over the others. So thank you, Drew Validic and Mahita from Echo Health Ventures for joining us today. And thank you to everybody who attended our Lunch and Learn. I hope you come to the next ones as well. Have a great afternoon.
Thanks, everyone.
Cool.
Bye.
Thank you.